Today, I'd like to discuss epidural steroid injections and some facts that people may not know and are feeling like they're being coerced by their doctor into getting, instead of just being prescribed appropriately, pain medications that would help your condition. Let's talk about some facts about epidural steroid injections. First of all, epidural steroid injections are not recommended by the FDA at all. They are banned in other countries. They are still being used in the United States in a coercive manner instead of doctors just prescribing opioids appropriately for patients that present appropriately who would be deemed appropriate patients. Epidural steroid injections, the main ingredient, usually Kenalog or a sister medication, has an FDA black box warning against being injected into the spinal cord space.
Is injected into the spinal cord. That's a big no-no, folks. You don't inject anything into the spinal cord. You don't touch the spinal cord. It's very delicate. You mess with the spinal cord, you go paralyzed. So it is complete malpractice, below the standard of care, to inject someone's spinal cord with epidural medicine.
Additionally, doctors do not properly inform their patients with the consent that's necessary. Informed consent, meaning all pros and cons are discussed. Did they tell you that it can cause adhesive arachnoiditis, which is one of the most painful conditions? Did they tell you it could possibly cause death, disc deterioration, tissue deterioration, nerve damage, permanent injury, and paralysis? No, I bet you they didn't. All of these facts can be found on the FDA website. If you look outside the United States, you will see even more risks that have proven to have happened directly from epidural spinal cord injections. Not to mention, they have been reported with a very low efficacy in pain management, especially when we're talking about spinal pain, which is almost always what they're used for. Your doctor will consistently try to say, oh, but we're going to use it for diagnostics. Well, what's the pros and cons of that? You're going to diagnose me, and when the pain is completely increased and that is irreversible, what's your diagnosis going to be? Permanent injury? You have put me in a worse position now. No, thank you. In addition, they're incredibly lucrative. They can run up to $2,000 per injection session per patient. And then think about this. The training for epidural spinal injections is a weekend seminar teaching them to inject you in your spine with toxic steroids and medications. For a weekend of learning, I don't know about you, but I don't want someone who just went through 1 weekend worth of training to inject something into my spinal cord that can kill me, paralyze me, or disable me for life. Just saying. Before you consent to epidural spinal cord injections, please inform yourself 100%. If your doctor is giving you pushback, give him these resources. Protect yourself and others from coercive procedures from pain management doctors trying to avoid to prescribe you appropriate medications for your conditions.